An adult at rest normally inhales 8 liters of air per minute and requires more air when exercising, much greater than the amount of blood being pumped by the heart per minute, which is about 5 liters, and also more than the amount of water we need to take in every day, which is about 2.5 liters.
The air that we take in comprises 20% oxygen and exhale 15% oxygen. Therefore, only 5% of oxygen in the entire air we take in is consumed, meaning a human body actually uses about 550 liters of pure oxygen a day.
Although nutrients, water, and sunlight is needed for a human to survive, the numbers presented a while ago shows that more than anything else, we need oxygen to survive.
And this is where one of our systems focuses on the gas exchange that happens from our tiniest alveoli to the environment.
The respiratory system. We, from the University of the Philippines College of Science, will discuss to you the function of the organs in the respiratory system, its histological components, some clinical correlations, and on how to take care of the system that should be first checked aside from consciousness in giving first aid. The respiratory system can be divided into two parts anatomically, which is the upper respiratory tract, composed of the sphenoid sinuses, frontal sinuses, nasal cavities, and the pharynx, and the lower respiratory tract, which is composed of the larynx, trachea, and the bronchi, and the lungs. The conducting portion consists of the nasal cavities, nasopharynx, larynx, trachea, and bronchi.
Another difference which was considered is the histological component of the two divisions. What then separates the tissues of the conducting portion from that of the respiratory portion?
Most of the epithelia found on the conducting portion is lined with ciliated pseudostratified columnar epithelium and is known as the respiratory epithelium.
The respiratory zone is the site where oxygen and carbon dioxide exchange happens with the blood. The respiratory bronchioles and the alveolar ducts are responsible for 10% of the gas exchange, while the alveoli is responsible for the 90%.
The ventilating mechanism of the respiratory system includes inspiration and expiration. During inspiration, contraction of the intercostal muscles elevates the ribs, and contraction of the diaphragm lowers the bottom of the thoracic cavity, increasing its diameter and resulting in pulmonary expansion. The bronchi and bronchioles increase in diameter and length during inspiration. The respiratory portion also enlarges, mainly as a result of expansion of the alveolar ducts. Individual alveoli enlarge only slightly. The elastic fibers of the pulmonary parenchyma are stretched by this expansion. During expiration, the lungs retract passively due to muscle relaxation, and the elastic fibers return to the unstretched position. Here are some respiratory disorders or diseases. Immotile cilia syndrome, a disorder that causes infertility in men, and chronic respiratory tract infections in both sexes, is caused by immobility of cilia and flagella induced, in some cases by deficiency of dynein, a protein normally present in the cilia and participates in the ciliary movement. Sinusitis is an inflammatory process of the sinuses that may persist for long periods of time, mainly because of obstruction of drainage orifices. Asthma is a chronic inflammatory disease of airways that manifests as paroxysmal contraction of airway smooth muscle, which causes narrowing of the airway lumens in response to exposure to a variety of triggers including allergens, infection, and exercise. Airway narrowing results in shortness of breath. Here are ways to keep your respiratory system healthy. Quit smoking or simply don't smoke. Have a regular exercise. Maintain a balanced diet. And importantly, get a yearly medical checkup.